flow. And although cash flow is an important one because we want to be able to assess, figure out what is causing us to have poor cash flow, and the problems of just using an income statement and balance sheet don't always reflect on what cash we have. But one of the things that we have to do to help improve cash flow is to determine what are things that might affect gross margin. And so in today's differential analysis, we're going to talk in today's lecture about differential analysis, we're going to talk about how this type of technique can help us in those situations. Everybody knows their costs, don't they? Or they should. Do they know how their costs behave? Obviously, prices can go up and fluctuate. Services can go up and fluctuate. How we pay our employees, how we operate our expenses, all can have effects on our profit. How we are reimbursed by third-party payers can also have that. But we have different types of costs that we have to be aware of. We have variable costs, and variable costs per unit are constant. So for example, the more prescriptions we fill, the more prescription vials, the more labels we'll use. Fixed costs. Fixed costs are things that are already paid for. They don't vary with production level. We are open a set amount of hours, 9 a.m. to 7 p.m. We have to pay the electricity regardless. We have certain different assets. We have a computer software program that we pay maintenance on, regardless of the number of prescriptions we fill. And then there's mixed cost. There's several semi-variable costs that change in total with changes in production level, but not always proportionally. Things we need to recognize in looking at the cost volume profit analysis. So obviously profit is a reflection of our sales, of whatever it is we're selling, minus our variable costs, minus our fixed costs. The other thing we have to take into consideration is contribution margin. Contribution margin is a product's price minus all associated variable costs, resulting in the incremental profit earned for each unit sold. The total contribution margin generated by an entity represents the total earnings available to pay for fixed expenses and to generate costs. So the formula for contribution margin is as follows. All right. It is obviously sales minus variable costs divided by sales will give you the contribution margin ratio. We talked in prior lecture about break-even point. And break-even point is where our sales equals our fixed cost plus our contribution margin ratio, which takes into account our variable costs. And so if we have costs or revenue and we have the quantity produced, we are going to have several things occur. And so there's eventually going to be a break-even point where our revenue coming in is going to at least cover our costs. So for example, anytime somebody's starting a new business, initially we're not at that break-even point, or we're starting a new service. So we always have to determine what is that breaking point. But the difference in differential analysis is at what point after we get to that break-even point, if we increase volume of a certain thing, that we may have to affect fixed costs, which may also affect our profit margin. And so we have to constantly look at that from different aspects. An example of this, we always have been traditionally talking about the selling of a product, our prescription. But if you're trying to get into things such as MTM type of services, you have to think about there are costs associated with doing clinical services. Most of the time when we get paid for an MTM service, such as we'll use Marixa Outcomes, we get paid a fixed fee for doing a medication therapy review. But that payment that we get is only the time we spend with a patient. This happens also in the physician world. Physicians are only paid in the time they see the patient. But you have to make sure that the time you spend with the patient, that what you get reimbursed also covers your non-billable time, such as report writing, developing contracts, following up with prescribers, marketing, support staff time. So a lot of times when you're evaluating, yeah, I'm getting paid this amount, it's not just covering salaries, but it's covering other non-billable services that are required for this to occur. The other thing is when we're looking at any type of service, we need to look at what our variable costs are and our fixed costs are. Fixed cost examples are our rent and space. So regardless of whatever we do, that space is there. But in terms of things like differential analysis that we're going to talk about in this lecture, is that 150 square foot area, is it better to have a consultation table there to do a service, or is it better to have some type of product display that we might be selling, something like CBD oil? And so we're always determining what is the service or sale we're doing and how does it impact fixed expenses. Other examples of fixed expenses costs are phone internet service, clinical resources, marketing, insurance malpractice. Now, in our prior lecture where we talked about cash flow, these are things that we always have to look at. What are we spending on? Are we getting a return on investment? Is there other cheaper alternatives to help control these fixed expenses, which have an impact on our gross margin? Variable expenses usually are, associated with the volume of the service or the product. And this can be office supplies. This could be, if we are doing a delivery service, how often we travel. It could be our prescription vials, our labels. And so we need to track these expenses when we're doing these analysis. The other thing when we're doing a differential analysis, whether it's a service or product, is how much are we getting paid? And so we also have to look at what do we price our service and what is the value of our service. And that service can or product can be determined is what will the volume be of this service or product? What is our operating costs? And also looking at what is our return on investment. So what is our profit versus what is our total cost spent? So we always have to be taking an analysis of this. I open this lecture in talking about services just because I think this is the new realm for pharmacy in the future, but we have to look at this also from a business standpoint. So in doing any type of services within our pharmacy, whether it's the one you're doing with and working with the physician's office, immunizations, MTMs, we need to take a look at what are our direct costs that are covering the delivering of this service, such as licensing, education, marketing, supplies, personnel, but then also those indirect costs that we're also, even though this is just one entity of our business, we're still using the computer, we're still using the same space where we're selling product, we're also being covered by the same insurance and legal fees, and those are our indirect costs. So, for example, say that we are trying to do like a hyperlipidemia program. And maybe in our hyperlipidemia program, we are going to have technicians and pharmacists. We may do testing. Maybe we're going to do a cholesterol testing. And so we may purchase a fixed item like a cholesterol machine. Or we get into diabetes, we purchase point of care testing to do hemoglobin A1C. We know there might be a fixed cost of getting certified, and maybe that's a one-time certification, or maybe just like immunizations, we have to renew our license and get CE at least every 2 years. We also may have to do some remodeling, and there's a cost in terms of remodeling. And so the thing is, we need to know the exact cost that we're doing so we can evaluate the return of investment. And so calculating costs of a program, we need to look at our materials and supplies, our direct costs, our non-direct costs, and the salaries that are inputted. So anytime we're looking at what does it truly cost to deliver a service, you should look at salaries, materials, direct costs, and indirect costs, overhead costs. And those will help determine what does it cost to do that. So for example, if I was doing a hyperlipidemia program, and say in this hyperlipidemia program, we are going to do a test, and say that to perform the test, just the test kit alone cost $12.50. Yeah, $12.50. Okay. If I had a pharmacist doing this, if I was paying a pharmacist $50 an hour, the cost of the test, I'm sorry, I flipped that, is $10.80. So my total cost to deliver this service, even if I don't factor in indirect costs, just doing simple math, would be around $23.50. Now, if let's go back here, the average reimbursement for building Medicare to be reimbursed for hyperlipidemia test is like $18.75, then if you take a look, well, I actually lose money on this. Well, how might I be able to change how I do this? Maybe I have a trained technician who does the test and the pharmacist just does the evaluation. Same with an immunization program. You have a fixed cost of a product and you have an administration fee, and you have a certain net profit you're going to make from that. Well, you could factor in, for example, a flu clinic. How many flu shots can the pharmacist do, and how many pharmacists do you want involved in that, and how many technicians? And so what is the total cost of delivering, say, one flu clinic for 3 hours? Or, so we always want to be factoring those things in evaluating our costs. Another example is a hypertension program. So, for example, if I have a hypertension program where I want for people to be in this program, this is they would actually have to pay to buy the blood pressure monitor. So it's a one-time purchase sale that I'm going to have. And for every month, I'm going to review their blood pressure drugs with them, their blood pressure readings and their medications, and that cost is $10. There's a program out there now that you could partner with physicians called remote patient monitoring, where there's a set fee you can bill Medicare, which is a little bit higher, but for the sake of this example, we'll do simple math. So say that I do an analysis of anybody that would be eligible for my service. And for simple math, say that I have 200 patients that would be eligible. And all 200 patients are on at least one blood pressure drug. And that one blood pressure drug averages around $19.99. So even if I never delivered this service, it would be around $48,000 I would take in revenue for doing that. But if they want to be part of this service, I am going to sell them one blood pressure machine, which is $4,520 if I times it by the number of potential patients that might be in this program. And so that is a way that I can do an analysis of projecting what would be my total sales of this program. So, for example, say that I only have 113 patients that out of the 200 are interested. So then I would take the 113 times 40, and that's how much I'd have sales in blood pressure. So my total sales with prescriptions and equipment sales was 52,000. Now, I know that our cost of goods is probably a little bit higher than 70%, but just for the sake of the exercise, say that my cost of goods is 70% of my total sales. Well, there's my 36,000, and you could use whatever your cost of goods sold is in your pharmacy. Your gross profit is around 15,000. Now there's variable cost. There's the cost, as I said before, your salaries to talking to the patients, your wages, not your wages, your obviously the prescription vials, the labels, and those variable costs, education material you might provide. And so if you add the variable costs, our net profit is around 7,000. Now say that I added the education and monitoring revenue that I'm going to talk to the patient once a month. Now truly to evaluate my cost, I will look at how much time the pharmacist spends, how much time the technician spends, and I'd factor into those salaries. But just for the sake of a quick exercise, those costs, because it determines the amount of patients we're going to see, those are variable costs. And so if I just used a rough estimate of 15% for variable cost, I can get that I'm going to get at least a net profit in just the clinical service of around 11,000. And so by just adding the service, I've got 19,407. Now, I've talked to you in the past about doing collaborative practice agreements with physicians, and so you could do that too. So say you're doing a chronic care management program with a physician, and say the average reimbursement per month for that chronic care management is $45, and say that you come up with the physician that you're going to take a percentage of that because the physician's still billing it, and say that you're going to take from that 30%. So for every patient that you talk to for 20 minutes, that's going to be $13.50. Now you would factor in what is the cost of your pharmacist salary for that, and is it worth doing? It might not be at $13.50. So you might equate that I need, out of that $43, I need at least maybe 60% of that $43. And so this is the ways we start planning on how to do a service, and evaluating costs and profitability. I've always talked in prior classes you've had with me in undergrad, and now anytime we're trying to market a service with a physician, we know that, or a health plan, the ultimate goal is to try to improve star ratings and HEDIS measure numbers, but also help to decrease the most costly things in healthcare, such as hospitalizations and ER visits. This is a good exercise that comes from the Financial for Pharmacists book, talking about how would you evaluate the cost of a service. And so here's an example. Pharmacist Jones wants to start a diabetic care center in his community pharmacy. The Diabetic Care Center will provide counseling, educational, and monitoring services to diabetic patients. Pharmacist Jones plans for the basic unit of service to be a 15-minute counseling, education, monitoring session. At first step in setting up the reasonable price, he needs to estimate the cost of the session. What do you want to know, and what do you want to be able to get for the cost for the service? Well, here's some facts. The pharmacist Jones is looking to do this for about 6 hours per week. He's going to offer this service. He's going to use a pharmacist's salary for the operation of a part-time pharmacist at $45 an hour. He's going to pay that pharmacist over a 52-week period. The owner will help manage the account for 3 hours of a 60-hour work week, and so that'll be about $115,000 of his total salary. The tech time is going to be 2 hours, and the tech will be one who normally works 40 hours in the pharmacy, and her annual salary is around $24,960. He's going to do some remodeling, so there's going to be some cost there, and he'll occupy 150 square feet of rented floor space. Total pharmacy space is around 4,500 square feet. The cost of renovation equipment will be $18,000 depreciated over 6 years, which will be about $3,000 per year. He's going to do some marketing and budgeting for the promotion, which will be around $2,400 a year. And his projected annual volume is 1,000 sessions, so he wants to charge $30 a session. So if he charges $30 a session, he's going to have 1,000 sessions. We know our total sales for that year is going to be $30,000. So the question is, what is the direct costs that we have to calculate to truly what is the cost to deliver this service, and what are the indirect costs? So some direct costs are depreciation, promotion, and salary expenses. Some indirect costs are rent, utilities, which will be about 3.1% of the total costs. So the direct costs include the remodeling, which we're going to depreciate at $3,000 per year. We're going to do some marketing. We have the direct pharmacist salary, about $14,000. We have the percentage of what we're going to take from the tech salary that we're going to devote 2 hours a week. We have the pharmacist manager. And so our total direct cost is around $26,438. If we look at our indirect costs, if our housing and utilities per year is around $34,000, and we have 150 square feet, and so then we are going to our total cost for that is going to be around $113. If we look at the miscellaneous expenses, the total sales for the pharmacy is around $2 million. So if the total projected sales is around $30,000, the percentage of indirect costs, all right, is going to be, if you take basically what you take is you take the 30,000, you times the 2,000 by the 3.1%, so then it's going to be about $930. So the total indirect cost is around $2,043, and the total direct cost is around $26,000. So the total cost to deliver the service for a whole year is $28,481. And so if we take a look at that, is what it's going to what it's going to cost per session to deliver is going to be around $28.48. So if I'm only charging $30, that means I'm only making $1.52. And we also didn't add some variable costs such as supplies. And all this cost is services dependent on 1,000 sessions. Well, one of the things in differential analysis and contribution margins we think about is how long can I increase the volume? So what if I increase the volume to 2,000? Does my cost stay the same? All right. Can we still do the same thing with 2,000 sessions? And that is what we're going to talk about with differential analysis here, because this doesn't seem profitable, but at least it doesn't look like we're losing money. And maybe this service will bring in new diabetic business. So just like your business plan you're doing with the physician is, what's the cost going to be per week of time for a pharmacist technician? What is the cost, what is the total cost to deliver that service, the marketing? And even though maybe it's a low margin, what is the potential return on investment of new customers? And so what percentage of additional cardiovascular patients you might get in your service, in your pharmacy. So although this doesn't seem profitable, it may have other returns on investment. But if this service fails and maybe we do half of what we do, we're obviously going to potentially maybe lose money. So it's really important that, in the pharmacy business or any type of business, we look at, the different places as management hubs. So we have to look at our profit center, all right? And that is the subunit that has responsibility for driving revenue as well as for controlling costs. So the main hub in a community pharmacy is the filling of prescriptions, and the cost center is the responsibility for controlling costs but does not sell product. Example, service departments. And so does your service department generate revenue, or does your service department help bring in more sales for profit, such as prescriptions? So when we do profit center analysis, we need to organize the business into subunits, the profit center and the cost centers. We need to track variable costs to the profit centers. We need to make sure we're allocating appropriate assets to these subunits, and we always have to be evaluating that contribution margin and the amount of capital invested. So as long as the differential revenue is greater than the differential cost, then it's worth it. And so when we look at, evaluating anything new we're adding into the business, we have to make sure that, that we are controlling costs. Does this increase our costs? And if it does increase our costs, are we seeing increased profit to offset those costs? So differential analysis, and please read the chapter, it does a good job of providing examples and detail, it looks at several different things. And differential analysis looks at is decision method to choose among alternative courses of action. And alternative courses of action is what additional processing will be needed to add on to this maybe new service or new third-party contract. What do we need to purchase in terms of expenses to make or buy, or should we just drop the service altogether? Is this a service maybe we should outsource somebody else to do? And is it a core competency of our business plan? So the 4 steps in doing differential analysis are the following. Identify differential revenues. Identify differential costs. Calculate that contribution margin and consider non-quantitative factors. A situation where differential analysis may be played is how we decide, do we participate in a third-party prescription program? And I think this is very important when you're deciding, should I belong to a preferred network or not? Or should I add a new service or not, such as some type of MTM service, a packaging service, any type of point-of-care testing service? So here's my example, and it comes right from the differential analysis chapter from Financing for Pharmacists. So please go back and look at the chapter and reevaluate. So for example, Buckeye Pharmacy is considering whether to participate in a third-party prescription plan. The particular plan with which Buckeye Pharmacy is negotiating offers to reimburse the pharmacy the ingredient cost of the drug plus $2.50 for each prescription dispensed. You can tell this is a little bit of an older chapter. It would be nice to have $2.50 for each prescription in today's world, unfortunately. If Buckeye participates, it will gain new patients who are covered by the plan, an additional prescription volume, and it will have additional prescription volume. The alternatives available to Buckeye's manager are to participate in the plan or to not participate in the plan. So let's look at the differential cost and revenue. Is the additional cost or revenue occurred when one alternative is chosen over the other? So if we take the plan, what will our cost and revenue be? And is it worth it? And what's our cost and revenue if we don't take the plan? Opportunity costs is the benefit of giving up by selecting one alternative or the other. Is the interest on the store, gained? Sunk costs are costs that are already incurred and not reversible. So for example, an example they give this in the book is, say that I decide to go with one group purchasing organization and I have to put in a set amount of investment, and maybe that I find that is not the savings that I was getting in purchasing product, but there's another place and I'm going to now have to put an investment there. Well, my sunk cost is I've already purchased this to be in this group purchasing organization, and is it worth staying to? That's something you have to consider also when you're switching PSAOs, because there are costs associated in being a PSAO or getting out of a PSAO. So getting back to our example. So the example So when we look at the differential revenue and the differential costs, they consist of the following: $2.50 per prescription fee by the number of prescriptions dispensed to the patients covered by the plan. So one way to do this, for example, if you were looking to maybe get into a closed pharmacy network, is how many patients can you go back and look at your data of how many patients you've lost over the last couple of years that may have left because you were not in a preferred network. Maybe you could do a survey of how many patients would use your pharmacy more if you were in a preferred network. Of that, how many patients do you currently serve that are still with you and would benefit from this program? Because there are some people, for example, in a preferred network won't benefit, especially if they have PACE or they're low assistance. And so, you kind of got to do a little bit of marketing analysis to be able to determine that. The differential cost is the cost that will change if the alternative is selected. So for example, if I do join to be in this preferred network, I'm also setting myself up for potential DIR fees. And so in talking to the PSAO, you must ask, what were the DIR fees of pharmacies being in this network, or talk to pharmacies that are now in this network, and what were their costs associated with that? Because you're looking at, am I going to bring in enough volume and profit to be able to offset these costs? And that is where the contribution margin is the differential revenues minus the differential cost. Other non-quantitative factors to consider is, if I increase my volume, will I have to increase my staff? Will I have to expand my hours? Will I have to purchase other capital expenditures like a new computer? Would that increase my delivery costs? So all of those non-quantitative factors have to be taken into place. And so what we should be doing is looking at is our revenue, what additional processing or tasks have to be on to evaluate this. And we need to look at what are the additional costs we may have to buy. How does this affect our fixed cost to be able to do this? So differential analysis also can help in determining whether or not I should stop a service. And things happen is, what will happen to the common costs if the enterprise is dropped? So for example, maybe I do dry cleaning, or maybe you are into photo processing. What will happen if I eliminate that service? What resources have been used for that service, and what can I do if I reallocate those services. And so those are things that we always have to be taken into consideration. So, for example, getting back to our example, say that we decide to participate in the plan and it will increase our volume by 600 prescriptions per year. Well, our direct revenue would be the 600 prescriptions per year plus the dispensing fee, so that's an additional $1,500. If I do this, it's going to cost me an additional 50 cents per claim, so my cost is going to go up $300. If I have no need for increase or salaries or fixed costs, I'm going to, potentially see at least a contribution margin by adding this service of around $1,200. If I increase by 600 prescriptions a month, all right, times 250 times 12 months, all right, this is 18,000. If I take into my direct costs, which my current direct cost is 15,000, and I add the 600 prescriptions, which is going to add another 50 cents per claim for my costs, I'm going to see an increase in direct costs of 18,000. So in this situation, I'm going to see a decrease in profit. But what would happen if some of the private pay people we make $7 prescription, actually maybe this plan I sign is with a local employer, and maybe these people were coming to me because, and you could use a situation in a preferred network. So for example, how many people do you currently have that do not go to a preferred pharmacy and still use you, and how will their reimbursement change if I switch? They will obviously be paying less, but you will obviously be possibly being reimbursed less. So this situation 3 could be applied to preferred networks. But what would happen if I had, like I said, a local employer, and these people were coming to me because I didn't take their insurance anyways, and I was making $7 prescription, but now that I am going to take this insurance, that $7 per prescription is going to go down to $2.50 per prescription, so I'm going to see a decrease in revenue. And so assume I could lose 500 prescriptions for not participating. So if, say that, for example, these people leave me for that contract and I don't get them, well, that's going to be 3,500. Whereas, and 3,500, and then my direct costs is 250, so I'm going to see a decrease in revenue. These people stay with me about $3,250. So I'll lose $4.50 on a prescription on those 500, and so my direct revenue per claim was 2,250. So if you take a look, that means that even though I am decreasing my revenue by 3,250, I'm still making some profit, versus if I didn't, participate, I would lose all that profit to begin with. I would lose 3,500, whereas at least I'm going to still retain some of that profit. So that is, I think, a great example of looking, do I participate in a preferred network or I don't? Now, it's not that simple of a formula because you got to think about the DIR fees. But when we talk live, Tom, I'd love to talk about this because I think this is something that we have to. Some other situations that can impact. So, example, what if I, obviously nobody's offering a $4 prescription plan, but what if I offer some type of value plan for cash paying customers? What is the impact we're seeing on Medicaid contracts, especially these Medicaid managed cares? And I always have to be looking to make sure reimbursement isn't too low than my costs. And how obviously volume sometimes can offset those costs, but sometimes they could worsen the quality of my service because I'm going to have to increase more staff. Or the other thing is the volume doesn't make up in covering my total costs. The other thing is determining when to break loose of a profitable product or service. And so one of the things as we talked in the cash flow thing is looking at whether or not we stay or not. And the example that they give in the chapter of differential analysis is actually a hospital looking at whether or not they should keep their pharmacy or not. And so basically, what they do is they look at the revenue that they're bringing in, the total cost of goods sold, the gross margin. They're looking at the salaries, other direct costs, and indirect costs. And right now, the pharmacy that this outpatient, this hospital has for their outpatient pharmacies, losing $10,000 per year. Now, one of the things is if they close that pharmacy, they're going to have no alternative, whether, can they get rid of some of those salaries? Will they have to incur some of those salaries? And what will those expenses take into place? And so all of these costs and costs of goods, salaries, and other direct costs would be eliminated if the pharmacy was closed. And so if they close the pharmacy, they're going to see the hospital is going to see a net income of $500,000 with their pharmacy. But if the hospital actually increased its profits, would they actually increase their profits by closing the pharmacy? And so basically, they then have to do the following. So if I go back here, I look at their total revenue was $300,000 for this outpatient pharmacy, and they lost $10,000. And the income statement for the hospital is $500,000 in revenue, and they have a net income of $5 million, and they have a net income of $500,000. All right, so we have to look at this differential revenue of $300,000. We look at the cost of goods sold, the salaries and other direct costs that would come out, and so the contribution margin is around $20,000. And so that means that the total that $20,000 would come off the net income of the total hospital's income statement. And so basically, even though they're losing $10,000 in the outpatient pharmacy, they're going to lose a total of $20,000 from the revenue that was coming in from that. So it might not be a good service to do that. However, what if they were going to put something else in there and rent its space? So maybe they're going to move the arthritis clinic into that space, and in that space they're going to be able to collect $24,000 per year in rent. Well, this is an opportunity cost, and therefore the contribution margin is less than $4,000. And so, if we did that, then the hospital is going to see a net income of additional $4,000 versus the $20,000 if they closed the pharmacy and did nothing. And so, the differential analysis allows you to compare and lose. And so one of the things sometimes pharmacies that own multiple pharmacies get into is, I got to close this one pharmacy because it's not making a lot of money. However, that pharmacy is also offsetting a lot of the central expenses to help in managerial salaries. And so if I close that pharmacy, what is it going to be to the total bottom line? And even though it's losing money, and that is why in the chain world or in small chain world, you see some pharmacies that are not that profitable still stay in business because its contribution margin can have a negative impact. So in this example, the outpatient pharmacy provides needed service, and the other thing we have to consider, even though it's losing money, what's the negative effect? And the negative effect could be that this outpatient pharmacy helps fill discharge prescriptions, and the hospital gets penalized if people get readmitted. So there might be benefits of keeping that. These are just examples of differential analysis, and I think sometimes having a tape lecture doesn't always give credit to what we're talking about. I think sometimes having some in-class discussion is good for this. So I'd like you to make sure you've read the chapters and go back, and I kind of just want to reflect on what I talked about here, and we'll maybe give some other case examples when we meet. Thank you very much.